Hi everyone, and welcome to our module on vaginitis. Vaginitis refers to infection, inflammation, or a change in the content of the normal vaginal flora. And when this happens, that can lead to vaginal discharge and odor. It can also lead to itching and pelvic discomfort. And there are three major causes of vaginitis. The first is bacterial vaginosis, the second is trichomoniasis, and the last one is vulvovaginal candidiasis. And we'll go through each of these one at a time in this video. Bacterial vaginosis results from an alteration of the vaginal flora. There are a number of bacteria that are normally found in the vagina, and when the makeup of those bacteria changes, that's what leads to bacterial vaginosis. One of the changes that occurs is a decrease in the number of lactobacilli found in the vagina. These bacteria produce hydrogen peroxide and they maintain a low pH in the vaginal fluid. Another important change is an increase in many other species of bacteria other than lactobacilli. There are lots of gram-negative rods whose numbers go up in bacterial vaginosis. And then a major bacteria that increases in number in bacterial vaginosis is Gardnerella vaginalis. And so this is depicted in this image on the slide. Normally you have lots of lactobacilli and a healthy vaginal mucosa with a very low pH because of these lactobacilli. In bacterial vaginosis, there's a decrease in the lactobacilli and there's an increase in other bacteria, including Gardnerella vaginalis. Some of the risk factors for BV are shown on this slide. First of all, it's strongly associated with sexual activity. It's very rare for this to occur in women who are not sexually active. It isn't classified as a sexually transmitted infection, and that's because there's not a specific agent whose transmission leads to the condition, but nevertheless this usually occurs in women who are sexually active. It's also associated with douching and with smoking. The clinical features of BV include a vaginal discharge. It's usually thin and slightly off-white in color, and it tends to have an unpleasant odor, often described as a fishy smell. Let's talk about some of the tests you can do to make a diagnosis of bacterial vaginosis. One of the things you can do is determine the vaginal pH, which will be high in bacterial vaginosis. A normal vaginal pH is 4 to 4.5. In BV, it will be greater than 4.5 because remember, those lactobacilli are missing, and that's what keeps the pH low. You can also take a sample of vaginal discharge and make a saline wet mount and examine it under the microscope, and the classic finding is the presence of clue cells. This is what one looks like on the slide here. Clue cells are vaginal epithelial cells that are studded with bacteria, and when you see those, that indicates bacterial vaginosis. To see the clue cells, you make a wet mount using saline, but you can also make a wet mount using potassium hydroxide. This, however, will be negative in women who have bacterial vaginosis. Potassium hydroxide kills cells and it allows identification of yeast, so as we'll talk about later, it's important for making the diagnosis of candidiasis, but in women who have BV, it's going to be a negative test. And then the whiff test, also called the amine test, is part of the workup of vaginitis. This involves smelling the slide after applying potassium hydroxide. And in women who have bacterial vaginosis, this will bring out that fishy odor of BV. It's also called an amine odor. And so a positive whiff test is a classic finding in a woman who has bacterial vaginosis. There are 4 diagnostic criteria for BV. They're called Amsel's diagnostic criteria. One is the presence of thin homogeneous discharge. The second is a positive whiff test. The third is clue cells on microscopy. And the fourth is vaginal pH above 4.5. And if you have 3 of 4 criteria present, then that makes the diagnosis of bacterial vaginosis. The treatment for bacterial vaginosis is usually with metronidazole, although you can use clindamycin as an alternative. And the idea here is that either of these antibiotics will knock down the overgrowth of bacteria and allow the normal lactobacilli to repopulate the vaginal flora. There are oral and topical alternatives. One of the most popular ways to treat this condition is with topical metronidazole gel. It's very effective and it has the least side effects. Okay, moving on. Next, let's talk about Trichomonas vaginalis. So Trichomonas vaginalis is a protozoa and it causes infection of the urogenital tract. It can infect both men and women, but when men are infected, they're usually asymptomatic. Women with Trichomonas can develop vaginitis symptoms. We'll talk more about this in a minute. They can also develop symptoms of urethritis because the urethra and the urinary tract can be infected. So in addition to the discharge and the itching of vaginitis, women with Trichomonas infection can also have symptoms like dysuria and frequency. And Trichomonas is considered a sexually transmitted infection. The initial infection is always from sexual transmission. You can make the diagnosis of trichomonas by examining a sample of vaginal discharge on a saline wet mount. The classic finding is the presence of motile trichomonads. This is a picture of what they look like on the slide here. These are identified in 60 to 70% of cases. So we talked earlier about how a saline wet mount will identify clue cells in bacterial vaginosis, and trichomonas, it will identify motile trichomonads. The vaginal pH is elevated in trichomonas infection just like it is in bacterial vaginosis, and the potassium hydroxide wet mount test is going to be negative. We'll talk about this in a minute, but this test is only positive in cases of Candida fungal infection. You can send a sample of the vaginal discharge for nucleic acid amplification testing. This will detect Trichomonas vaginalis RNA. And then if you perform the whiff test like we described earlier, it's occasionally positive in Trichomonas. Classically, the whiff test is positive in bacterial vaginosis, but it can also sometimes be positive in cases of Trichomonas infection. The treatment of Trichomonas is usually with metronidazole, or sometimes a related drug is used called tinidazole. Patients usually take a 7-day oral course, and you have to treat the patient and the partner. Remember, this is sexually transmitted, so if you don't treat the partner, the patient will become reinfected. And then it's rare, but if patients have a severe allergy to metronidazole or tinidazole, usually they are referred for desensitization. The reason for this is that alternative drugs to the standard therapy are ineffective, and so patients need to be desensitized so they can tolerate this therapy in order to be cured of trichomonas. Okay, our last cause of vaginitis is vulvovaginal candidiasis, which many people simply call a yeast infection. This refers to an overgrowth of various species of Candida fungi. Usually it's Candida albicans. This is responsible for 90% of cases, but rarely it can be caused by other Candida species. Two that are often involved are Candida glabrata and Candida parapsilosis. And the key thing to understand about the way this infection occurs is it's an overgrowth infection. Candida are part of the normal vaginal flora in 10 to 20% of women. If they're allowed to grow excessively, that's what leads to vulvovaginal candidiasis. So the risk factors for candidiasis are anything that allows Candida to grow excessively. The classic cause is antibiotic use. This depletes the normal bacterial flora of the vagina, and it allows overgrowth of Candida. Diabetes is also a risk factor. Patients who are diabetic are immunosuppressed, and this can allow Candida to grow excessively. And so in any woman who develops vulvovaginal candidiasis without an obvious risk factor like antibiotic use, you should consider measuring her hemoglobin A1C, because this is the way diabetes is sometimes initially diagnosed. And then besides diabetes, any cause of immunosuppression can lead to overgrowth of Candida and vulvovaginal candidiasis. In terms of clinical features, the dominant symptom of Candida infection is pruritus. This is a very itchy condition. It can also lead to burning, and sometimes that burning is worse with urination, so it can be described as dysuria. In many cases, the discharge can be minimal or absent, but classically candidiasis causes a white, thick, and clumpy discharge. It can be described as curd-like or cottage cheese-like. When you do an exam, you'll see erythema of the vulva and the vaginal mucosa. And then lastly, you always want to remember about candidiasis that it causes minimal odor. Of the 3 causes of vaginitis, this one causes the least odor. You won't see a positive whiff test or anything like that in a woman who has candidiasis. In terms of diagnosis, the vaginal pH is normal, 4 to 4.5, in women with candidiasis infection, and this is a very important finding because in the other forms of vaginitis, the pH will be elevated. The key test for diagnosis of candidiasis is a potassium hydroxide wet mount. So Candida are budding yeast, so they form pseudohyphae and hyphae, and so if you place them on a slide and you add potassium hydroxide, which destroys cells, what you will see are the presence of hyphae and pseudohyphae, and that's what you can see here, these branching structures on a potassium hydroxide wet mount. Those are pseudohyphae. You can send a sample of vaginal discharge for a culture to identify Candida, but this is not routinely used. The only time this is done is if there's diagnostic uncertainty or in women who have persistent or recurrent symptoms despite treatment. So that's a nice segue into the treatment of candidiasis. For uncomplicated infections, these can be treated with a single dose of oral fluconazole. To be considered an uncomplicated infection, women have to have 3 or less episodes per year, their symptoms have to be mild to moderate, and they must be immunocompetent and non-pregnant. For women who have complicated infections, they are treated with longer duration of therapy or with different regimens. And then besides oral fluconazole, if women don't want to take an oral drug, there are also topical azoles which can be used. And there are some women who develop multiple infections with Candida per year, and in these cases, sometimes long-term suppressive therapy is used. Let me briefly mention Candida glabrata, which is one of the uncommon species of Candida that can cause candidiasis. This is a rare cause of symptomatic infection, and it's sometimes identified by culture in complex cases. So if a woman has recurrent candidiasis and she's not responding to treatment with azoles, then a culture will be sent, and sometimes that culture will identify Candida glabrata. In these cases, the treatment is with intravaginal boric acid. It's high yield to know this for your boards. Candida glabrata responds poorly to azoles, so you can't use the standard therapy. Instead, what is used is intravaginal boric acid. And so I'll finish with this table from the White Coat Companion showing the 3 different causes of vaginitis. Key things you want to remember are, first of all, the pH of vaginal discharge. It is elevated in BV and in trichomoniasis. The only condition in which it's normal is candidiasis. And then the wet mount is really key if the pH is elevated, because that will distinguish between BV and trichomonas. In bacterial vaginosis, you will see clue cells. In trichomoniasis, you will see motile trichomonads. And that concludes our module on vaginitis.